When left untreated, the bacteria found in tooth decay can multiply and advance through the layers of your tooth, from the root canals to the surface of the jawbone. This can lead to a severe infection in the nerve and blood supply, as well as enable a pus-filled pocket called an abscess to form around the gum and jawbone. Conventionally, a root canal treatment may be used to resolve this issue. However, an alternative, such as a tooth extraction, can be performed if preferred. The only cause of concern when performing a tooth extraction would be to ensure the quick replacement of the extracted tooth to ensure no further damage can be done by the potential movement of the neighboring teeth. Failure to do so will make it more difficult to adequately clean your teeth, since plaque and tartar will form around harder-to-reach places. If the extraction site were to be restored with a non-removable option like a dental implant, the cost to have extracted and then replaced the tooth will have made a root canal a more cost-effective option.